One of the challenges in dealing with a person with Huntington's disease is that the disease itself commonly causes unawareness, meaning that the patient is unaware of their symptoms. Sometimes it feels like it shades more into denial of symptoms, more of an active process, but often it really seems to be that they're unaware of their involuntary movements, unaware that they can't problem solve as well as they used to, and it's very difficult to take care of somebody who doesn't think they have a problem. Interestingly, there are different layers of unawareness. So I have had patients, for instance, who won't acknowledge that they have Huntington's disease, but if you want to talk about the funny movements that they have, they're happy to talk about that. So sometimes you can get around the unawareness by talking about a specific symptom without confronting them with this concept of Huntington's disease. And sometimes you have to be a little bit sneaky. So a medication might help somebody for sleep, which the patient acknowledges that they have a problem with, but that same medication might also help with depression or irritability that the patient doesn't acknowledge that they have. So sometimes you can use a drug that has dual purposes and get around the fact that the patient may be unaware of one of those two kinds of symptoms.
If you're unaware of your inability to safely drive, someone's going to have to tell you that you can't safely drive when you believe you still can, when you still believe you can do it. And for that individual with Huntington's who's unaware that they are unable to drive, the only way to make it clear to them that they can't is to give them examples of the times that they fail to drive safely, which is painful if you have Huntington's disease, or times that you fail to properly take care of your child, or times that you properly manage hygiene. And so you're confronting people with symptoms that they are blissfully ignorant of. So unawareness on one hand is painful for family members and painful for the person with Huntington's when confronted with their deficits. On another way of looking at it, though, is that it allows people to persevere at things as long as they can. You know, that you keep at it and you keep trying. And that helps bolster people's self-esteem. So it's a two-edged sword, and it really, the times that it becomes really an issue, once families accept it, is when there are safety issues involved. Either driving, someone forgets to stop eating, or they forget to eat, or they are unaware that they're not managing their kids' needs properly, or the one that frightens me the most, that they have weapons in their home that they still believe they can manage, and safety issues, or that they can't live by themselves any longer. So those are the times to intervene. Otherwise, the strategy for managing that is to help the family understand it and not fight it as much as they possibly can. It's very hard to see your loved one have such marked deficits and not want to confront them, but it's not useful. It just damages relationships, and it's one of those things you really need to pick your battles. There's no real treatment for it, no biological treatment. It often begins, there's some recent data from the University of Iowa where as people begin to phenoconvert, meaning they go from being asymptomatic to beginning to develop some motor signs, that's when reports of caregivers and patients diverge. Caregivers report more and more symptoms, and the patient reports fewer and fewer. So the idea is that roughly around the time of motor conversion, that may be the earliest signs of unawareness.